Hi po, ako po si Denalyn Sanchez ng San Carlos City, Pangasinan. Every time po na nagpo-post po sila, napapawaw ako. Sana all. Tapos nung nag-post si Dr. Elaine ng yung every tuwing December po, yun, na may pre-makeover. Yan, tungtawa ako. Sabi ko sa husband ko, follow mo yung page nila, tapos tag mo ako, mag-comment ka. Tapos nung nag-comment si hubby ko po, hindi naman po siya yung nakakaiyak na comment po. Kaya sabi ko sa kanya, dapat iyak, may konting iyak ka para mapili ako. Hindi, okay na yan, sabi niya. Tapos, nung after, yung mga sumali din po sa makeover smile, yung mga message nila, nakakaiyak, may konting drama. Pero si hubby ko, wala siyang drama-drama. Kaya, baka hindi ako mapili nito. Pero okay lang. Pero nung in-announce na po ni Dr. Aileen po yung winner, kinilig ako. Kasi dream ko po talaga magkaroon ng magandang Yan, naiyak na ako, sir. Mahalaga po siya kasi pag nakikipag-usap ka sa tao, siyempre tinitignan po nila yung ngipin mo. Baka mamaya may pangit yung pagkakaano ng ngipin mo, baka basta mahalaga po siya. Kasi importante po din po yung smell ng tao.
So, hi guys, this is Dr. Jonas Apostol. So, I'll be discussing the case of Denalyn. She's actually the winner of our free smile makeover here at Apostol Dental Cosmetic Center. So, when she went to the clinic, of course, we had a thorough assessment from x-ray to clinical to getting all the necessary diagnostics before we did the final treatment plan. So, importante dito actually, when we do our treatment, una, ina-assess namin to. I'm asking my staff to do the diagnostics just for us to check all the details. Not just yung nakikita, but also what's inside the teeth. No? Yun yung gums, yun yung the bone, the PDL. So, a lot of things that we have to consider, and we have to be in that certain parameters of health and function and beauty before we can come up with a treatment. Actually, ang ginawa namin dito, we did also a smile design outside the mouth, just for us to gauge the occlusion, yung kagat, kung kamusta ba, kung ano ba yung pwede natin magawa within the range of functional dentistry. So sa case ni Denalyn, as what you can see in the picture, meron siyang old fixed bridge. Okay? That old fixed bridge, the material used was porcelain fused to metal. So it has metal, yun yung base niya, yung coping, and then it was layered by porcelain. It's high fusing porcelain. But sometimes the problem with that kind of material for a certain treatment like crowns or bridge is that it's technique sensitive also. We have to consider that the margin should be a little bit inside the gums. Because we need to make sure that we conceal, we have to consider that in the future, when the porcelain will age, it can become obvious na magkakaroon ng shadowing. So, combination in the laboratory is technique sensitive. So, there should be a certain ratio with the metal and with the porcelain and with the opaquer. So ang daming technique. And also with the teeth as well, we have to consider the preparation. It should be a little bit more aggressive if we want to get the best result na tumatagal, na hindi mag-show yung metal. So, anyway, it's just only the material, no? Wala pa tayo dun sa gingival architecture. As what you can see here, it's not symmetrical. So, we have to get rid of that asymmetrical, gummy smile. So, how can we do that? Like if there's a gummy smile, we have to lift the gums a little bit, okay? But what are the parameters? What are the range? How can we do a certain gum contouring lang ba? Or do we need to involve the bone? It really depends on the positioning. Yung bone, we have to consider kung saan siya naka-position. So I have an in-house periodontist. She's the expert in the gums and the periodontium. So she is the one handling that certain specialty in my clinic.
So as we saw sa before photos ni Denalyn, she has very short anterior teeth. And pag tawang-tawa siya, her smile is very gummy. So I did a procedure called crown lengthening, where I surgically raised her gum line and reduced a little bit of bone to follow her natural smile line.
It's a collaboration. I need the expertise of my specialists. So specialists because it's not just about the gingival architecture. Hindi lang puro gums yung problem niya. There's actually an infection sa ngipin. And I need the help also of my endodontist. So the endodontist naman, yung trabaho niya naman is to make sure that na-root canal yung area na maayos. Okay? Na painless, atraumatic, hindi masakit. Okay? But it's always, case to case for pain, something like that. But my endodontist is really, really good at that certain field kasi yun yung specialty niya. Yun lang palagi ginagawa. So, I asked for her help. Siyempre, dapat the best yung mag-handle sa patient. So, we have to establish the health first of the teeth and the gums. So, that's why there's these specialists. After that, it's time for restoration. Okay? Sa restoration naman, ako na yon. But not just me. I have my team of dental technicians. So, I cannot do it alone. I have a team of technicians in-house. I mean, dito lang sila sa akin. That's why we can produce a bespoke smile na dito lang nakukuha. Kasi my idea can be translated into ceramics na gusto ko. Because they listen to me directly. And they are not just technicians, they're very, very good in what they're doing. We have our own CAD/CAM machine. We have our own press machine from Germany. And we don't compromise the quality. And that's why lahat ng pinoproduce namin dito, paying, non-paying, winners, we always give our best. Kasi hindi naman selective yung quality. It should be given sa lahat-lahat na pumupunta dito sa Apostol.
1 week later.
Thank you, Mama.
Thank you po.
Makakangiti ka na ng bongga-bongga.
Thank you, Doc.
See you sa follow-up mo, Mama.
So the case actually completed almost 2 months. Bakit almost 2 months? Number one, yung patient namin is actually based pa sa Pangasinan. So medyo malayo. No? I mean, hindi lang kami kumukuha ng winner kahit Mindanao ka pa, kahit saan lupalop ka. If ikaw yung nabigyan ng opportunity, then we will do our best. So, bakit almost 2 months? Not just geographically. I mean, hindi ibig sabihin na malayo, matagal. No. We have to consider also the healing time. Because after ng crown lengthening, it will take like a month for us to manipulate it. Para at least optimum yung result. Mas maganda. Secondly, we did, root canal. So we have a little bit of waiting time also for that. But mainly because of the crown lengthening. And gaano kahirap yung case? It's pretty complex. See, I needed the help of my specialist. Hindi siya yung parang madaling-madali na kaya ma-pull off. So it requires experienced eye. It requires experienced specialists for us to give what's best for the patient. So I chose zirconia material, zirconium oxide material in tetragonal phase, and we layered it with high fusing porcelain. Bakit siya kailangan layeran ng high fusing porcelain? For us to create a lifelike ceramics. So that doesn't mean that if we use zirconia, it's always monolithic. That's actually the thing in the past. We don't actually do that palagi. Siguro for some certain cases, pwede yun. But for this particular case, and most of the cases, they are actually layered to make sure that we produce a better outcome. Matibay, zirconia kasi it's far more superior than lithium disilicate when it comes to the strength. It's like thrice, 4 times harder. That's why we always choose this type of material. But it really depends on the case naman. But for the patient, this would be the best material. So with the final result here, wow, it's so beautiful. Grabe. It actually brings out the confidence, for the patient. She's more confident about her smile. Now her smile is less gummy and it's more symmetrical. The color is within the range of her skin tone. Mas bumagay lang. Hindi siya yung tipong sobrang puti na hindi siya natural looking. So ito, sakto lang. We also made sure that the result should be healthy. Healthy in a sense that there will be no impingement of the gums, that there will be no micro leakage. That's actually one of the reasons why the gum bleeds if there's, number one, impingement. Ibig sabihin nun, naiipit yung gums kasi wala masyadong margin or something like that. Or hindi na-establish sa una pa lang. So, when we do bridge crowns or veneers, may mga margins yan because we are establishing the margin so that there will be no micro leakage. Importante yan na healthy dapat. Okay? So, ito healthy siya. The bite, the occlusion, we have adjusted para functional. So, it should be functional. Okay? It should be healthy. And at the same time, it should be apostolified. Beautiful pala, aesthetically. So, apostolified smile is basically highly aesthetics, healthy, and functional. Okay? This kind of treatment or this kind of smile transformation it's like a bespoke one. It's customized to the patient's preference, to the patient's smile, to the patient's face. That's why we do dentofacial analysis, not just the teeth, but also the face in relation to the design that we're making sa ngipin. Kaya siya mas bagay or mas gumaganda.
Simula nung first illness journey ko, ang mabait po ng mga staff. Ang swerte ko din po kila Doc Jonas tsaka kay Doc Eileen kasi mayroon po silang ganitong generous and prestigious project na natulungan po nila ako. Tumas na po yung self-esteem ko ngayon. Confidently beautiful na ako dahil sa apostolified po. Ang galing po ng process, as in wow, kasi wala pa ako naramdamang pain. Pati yung root canal, pati yung sa gums ko po na kinontour po ni Doc Janine, as in wala po akong naramdaman na sakit. Huwag po kayong mawalan po ng pag-asa kasi may Apostol Dental po. With Apostol Dental, nothing is impossible with your smile transformation.